Every day, millions of Americans walk into hospitals with Medicaid. It covers their visit. It pays the bill. Problem solved, right? Not exactly. Medicaid is a joint federal and state program. It covers over 80 million Americans. That's nearly 1 in 4 people. Children, seniors in nursing homes, low-income adults, people with disabilities. But here's the catch. When a hospital treats a patient with private insurance, they might get paid $1,000 for a procedure.
Okay, I see where this is going. And again, I like to give you guys, especially with the academy, the business side of healthcare. So this is how this works with payments. This is where he's going with this. So private pay is going to be lower on the totem pole. Private insurance, right? Humana, Blue Cross Blue Shield, Aetna, those companies are going to pay the most, pretty much all the time. And so they're normally going to build that first. And then the second one is Medicare, Medicaid, and private pay. Now, you're saying to yourself, well, what is it that is making Medicaid patients forcing hospitals to go out of business? It's not forcing them to go out of business at all whatsoever. I'd argue that Medicaid pay, while significantly less than private insurance pay, is probably all they really need to function if they just did everything at Medicaid pay. But then again, if I said that out loud, again, people would be all upset, they'd be up in arms, and I can't believe he said that. But if you break it down, and I've been saying this for a while, if America, and it's just, this is an American problem, if we figured out how to help doctors ease that load of paying back that medical debt, they probably wouldn't need to make $500,000 a year. And then your CEOs of the hospitals, you're saying, well, they make a lot of money. So I have been on record saying that they do make a lot, but I've talked to a hospital CEO last week, and he heard my videos, and he said, Henry, we take on the liability. So when there's a problem, everyone's mad at us for what we did. And I said, well, how much do you make? He gave me a range. I said, and do you think that range of money is worth you taking on liability for a hospital? He says, yes, I think it's actually worth more. And he broke it down for me. He said, well, something goes wrong at our hospital. Who's the first person named? I said, the CEO. He says, correct. He said, something goes right with the first person named. He said, but if the hospital fails and I lose my job, I'm out of a job for 6 months to even sometimes a year. Sometimes you can never actually get a job again. I said, now I'll be honest, because I never worked for a system. I didn't know that. Super interesting to hear that, because in my mind, I'm always thinking if we paid the C-level executives less, we'd have a bigger margin and more way to treat people who are indigent. The real problem, though, is why hospitals are going broke and why they go out of business is because we have a program in place called